guys. This is Dr. Bidmos with Public Health Talks. And today I'll be talking about minding mental health, which means paying close attention to our mental health needs. And on today's show, I have Miss Vanessa Adebayo with me to help facilitate the discussion. So a brief intro about Vanessa. She is an experienced public health professional with about 3 years of experience providing high impact development, technical assistance, data evaluation, and program implementation services to nonprofit organizations working to improve the health and wellness of young youths, young adults, women, and children. Vanessa is also a founder of a nonprofit called Africa's Health Matters Foundation. So welcome to the show, and thank you for joining me today, Ms. Vanessa Adebayo.
Thank you for having me.
Yes. So can you please give me and my viewers a brief, introduction of your Africa's Mental Health Matters initiative?
So Africa's Mental Health Matters initiative is meant to destigmatize misconceptions about mental illness on the African continent. Furthermore, encourage young adults or anyone really to seek treatment if needed. We do this really through a social marketing campaign, through our social media platforms on Instagram, Facebook, Twitter, LinkedIn, and we do this by pretty much encouraging young adults to address mental health. We want to destigmatize it by bringing people that look like you, me, or whoever to tell their stories and encourage people that it's okay to not be okay. We also do this through our country teams, which are included in Lagos, Nigeria, Abuja, Nigeria, London in the UK, Kigali, Rwanda, and right now in DC in the United States. And we do this through programming. We have country ambassadors that implement different programming throughout the year. It could go from group therapy sessions to open mic nights to health and wellness development, activities, whatever really the committee or the country team would like to implement. But bottom line, it's mental health awareness, not only in the African continent, but in the diaspora.
Yeah, I think that's fantastic. Just because, in different part of the world right now, or different places or different communities, mental health is still a taboo. It's still something that still not being discussed or having conversation about. So this kind of initiative, I think, is needed, especially among youths, to bring awareness to such an important, public health topic. So, what inspires you to focus on mental health in Africa?
Coincidentally, I didn't ever think that it was going to be something that I went into. It wasn't particularly even the career path that I was thinking of going into, but I was fortunate to participate in a global public health program that gave me the flexibility to do it in 3 continents. I was in the US, I was in Ghana, and I was in Abu Dhabi. And while I was in Ghana, I took a social behavioral class that allowed us to go to a psych hospital in Accra, Ghana. And when I was there, I was able to witness the lack of resources, the stigma, and the vulnerability of a lot of the patients there. And I realized that this was a big issue. It seemed like a population that had kind of been left behind or forgotten. And to me, it was a question of, why isn't this in the news? Why isn't this in the newspapers? Why aren't people talking about this more? How can patients live like this, breathe like this? How can they even get better like this? And so that's what kind of really inspired me to want to do my master's thesis on the effectiveness of social marketing campaigns to improve attitudes and behaviors towards mental illness. Once again, I thought it was something that I was passionate about, but I never in a million years thought I would actually be implementing something on ground or in Africa. But I think my first step in planning a conference in Ghana, after I graduated really, inspired me to kind of move forward, because I received so much positive feedback from participants that attended. And I started to realize like this was a real issue. And a lot of people complained they didn't have a platform to be able to talk about this, discuss their issues, or even seek resources. And I also started to realize that it wasn't that the resources weren't necessarily available. It wasn't like people weren't making strides and, implementing programming and starting nonprofit organizations that focused on mental health, but it was about the awareness. People didn't know that it actually existed. And so I felt, what better platform than to create something where people then know what resources are available to them in each country, but then also have a place where they can get resources as well.
Okay, yeah. So, I mean, I think it's, you nailed it, awareness, that's a key thing here, especially in places where, it's still a taboo. So when people are still they're hearing about it and they know that it's a platform where they can freely discuss, what's going on personally without being judged, then I think, people will take advantage and utilize, such resources. So again, I think you mentioned a little bit, but I'm still gonna want you to go in depth, the next question I have. So please enlighten me and my viewers on some of the stigma against mental health disorders that you've heard and are shocking to you.
Well, when it comes to stigma is twofold, right? There's preconceived stigma, and there's stigma that you also feel that's coming from other people, right? So as far as I'm concerned, the major things I've seen are that there's stigma that people internalize, that other people feel about them. So if, God forbid, I'm dealing with schizophrenia, or I'm dealing with depression, or I'm dealing with anxiety, I may feel that other people will start to look at me differently. Maybe my coworkers won't respect me in the office. Maybe I won't be able to interact with my family as well, because they'll start to think that, juju is, there's some African juju, there's something that's, doing me. Like, basically it's how people perceive other people look at them, right? And then there's the other side of stigma where
could that be like, self-esteem issue as well? Like, when you talk about the internalized one, could that, low self-esteem come into play?
For sure, completely. I think it's internalized because you've now, a lot of time when people are dealing with things, and they've been labeled something, it's very hard for them to think outside of that label. So it's a lot of it, once again, is internalized. It could be a result of low self-esteem, but then also based on, their experiences. So if I've now been diagnosed as someone that's dealing with depression, I may think, okay, well, I remember when a friend of mine was, dealing with depression, and they, were mistreated, or they, someone said something about them. I may take those experiences that I've seen from other people and internalize it and put it on myself, if that makes any sense.
Yes, it does. Yeah.
And then the other fold of stigmas, of course, people just not having the proper health knowledge and understanding of what actual mental illness is and how it needs to be addressed. I think there's the health knowledge, and then there's also the lack of financial resources. So we see a lot of the time that a lot of patients that are put into mental health facilities, it's not because sometimes their family doesn't love them, or they don't, care to take care of them, but it's because they don't have the capability or the infrastructure in their homes to actually deal with someone that may be, going through a mental illness. And then number two, they may not even have the health knowledge, right? And that's where we need to fill in the gap, because a lot of people don't understand what their family members may be actually going through. And so they rather leave them in a facility to be able to figure that out. And a lot of the time, unfortunately, they're abandoned because many families can't even keep up with paying payments to have their family, to continue to have their family stay at a mental health facility. So you see a lot of the time, family members, especially on the continent, will pay a one-time fee to leave their family member in the facility and then go ghost and never come back. And so there were a lot of cases that I personally witnessed like that.
I mean, like, from my own experience, like, working in the community, like, most of this, when talk about in some of these public health issues, like mental health, for example, like, the problem that people have is that, like you said, they lack the knowledge, and and there isn't, you don't have the resources, like, for health educators to actually educate, the community on the issues. And I've heard people just snap out of it. This is something you're just making up in your head, like, oh, it's because you have enough food, that's why you're saying that, oh, I want to kill myself, or I'm depressed. Like, if you don't have enough food to eat, then you won't be thinking about that.
Thinking like that, yeah.
So, like, have you heard, like, crazy things like that?
Of course. I mean, first and foremost, there's the spiritual and cultural beliefs are the number one reason why people don't want to address mental health on the African continent specifically. We see that a lot of people, for example, not understanding what a mental illness is, they may think, oh, they're crazy, they're mad. On that, initially, when seeing someone that may not react or act in a normal, quote unquote, way, they will write you off and kind of just either ignore you or pass by you or just call you a mad person. They also may think, okay, you're possessed. The devil has taken over you. You need to go to church. We need to take you to a spiritual pastor, or we need to take you to a spiritual camp and have these demons be taken out of you because there's something seriously wrong. Some people think, oh, you know what, it's because, like you said, you're too privileged, you have a lot on your plate, because and I think it also comes back to this: as Africans, we're taught to be naturally strong. When you're coping is not just, I know in this whole era of COVID-19, everyone keeps on talking about coping mechanisms and how to get through, but I think Africans are born as copers. They've been taught from day one since they're born that.
Then also you're taught to not express your emotions. Yes, you're taught to internalize, your emotions, and, just deal with it.
Exactly. We're just taught to kind of just deal with it. So if you are now in a predicament where you can't deal with it and it's no longer under your control, then it becomes a serious issue.
Yeah. So then again, we're talking about, like, somebody having a suicidal thoughts. Then they who are they going to talk to when you live in a in a community or in a household where there's nobody to confide in and talk to them about your personal issues or whatever it is that you're going through. Yeah,
completely. And then furthermore, I mean, if we're talking about it from a policy point of view, how can you even mention something like that when it's a crime, right? Like, if you even attempt suicide, you could be thrown in jail.
Yeah.
And
it's a very a difficult thing to navigate in the African continent, specifically, like you said. So so how do we end the stigma and prevent some of the destructive behaviors associated with mental health disorders?
So that's a loaded question. I think I feel like since we started this 3 years ago, I've seen tremendous change and trajectory in regards to people's their knowledge and their point of views on mental health. And I think for me, the reason why I designed this initiative was because I felt if we could collaboratively come together in each country, stakeholders, mental health therapists, psychiatrists, advocates, public health professionals, stakeholders, influencers, and advocate and talk about and bring awareness to mental health, then how much more would that now have an effect on the community at large, or the young adults at large, in their thinking regarding being able to talk about it. I think stigma is something that the only way to address stigma is to bring awareness to it, so that it becomes a place of comfort where people can reach out to a family member, or maybe if it's not a family member, a friend, or if it's not a friend, maybe a therapist or someone that they can trust to confide in them when they do need the proper help or they need some type of support or encouragement. I think, it's been a journey, but I think each day gets better. I think, for example, not to digress, but I think in a situation with COVID-19, a lot of people have started to think about the mental health implications of this, not just here in the US, but also on the African continent. It's something that people are now starting to think about because they're forced to.
Yeah, globally, because this is something people are not used to. So it's taking a toll on physical and mental health. Yeah,
exactly. And I think when you humanize something like mental health, because like first and foremost, when we talk about mental health, it's like physical health. Mental health is our well-being at any moment in time, right? Like I could be having a conversation with you today, and then 2 seconds later something happens and it affects me mentally,
Yeah.
And so when people start to think about it and humanize it and make sure and understand it as something that we're that's constantly changing, that's constantly being that needs to be taken into consideration, then I think it will start to, the stigma will start to go away. And I know cancer was something very big that people initially had a problem with addressing, because they felt, the stigma of having it, or the stigma of dealing with cancer, kind of, remove them from society or dehumanize, the experience. But I think because there's been more conversation, there's been more advocates rising up, there's been more walks. Now a lot more people feel comfortable talking about it. So I do see that because of because of people stepping up to the plate, celebrities, influencers, stakeholders, nonprofit organizations, I do think that the stigma will slowly but surely get to a point where it no longer exists and people can freely and openly talk about mental health.
Yeah, I mean, in African continent, we're not there yet, but I mean, like you said, if we collectively come together and do that, then we can reach more people in terms of creating the awareness needed to shine a light on this issue in that part of the world. Yeah,
completely.
So, which brings me to my next question. So, I have a few people that have come up to me, indicating that they struggle balancing their physical and mental health. I mean, like on my page, I usually remind my on my Instagram page, I used to say that, don't forget to balance your, your physical health is as important as your mental health. Because when people think of health, they think of, going to the doctor, but, so people have come to me and, tell me that they indicating that they have the struggle balancing both. So how do you suppose, or how would you address those people?
I think they're equally important, right? Like if I'm physically not exercising and making sure that I'm eating well and I'm practicing, good sleeping habits, and I'm taking care of myself mentally, how can I expect to, advance and get, be in a good state? I think they work hand in hand. I think it is hard sometimes, but I think that getting into daily routine of putting yourself first is something that I recommend. I'm not a therapist, I'm just an advocate, but I always, from my conversations with different therapists and my conversations with different people, I think we need to just practice self-care. And what does self-care look like? Self-care looks like taking care of our physical health and our mental health, because hand in hand, they can't work without one another. And I think understanding that they're equally important definitely is important. I mean, we all run busy schedules. Some of us have more strenuous schedules than others, but I think that, like I said, getting into a day-to-day routine of where, one, you're putting yourself first and you're taking care of yourself, whatever that looks like for you, whether it's sleeping in an extra hour on the weekends, or making sure you go to bed early because you have to start an early day, or eating a full 3 meals a day, but making sure that they're in moderation, or eating those fruits and vegetables, whatever that looks like for you, whether it's taking a nap or going through, a daily devotion or prayer or meditation, whatever in your space it looks like, I think it's important. And if we emphasize self-care and self-wellness, then I think people can really understand how the two can integrate.
Yeah. So, I mean, in a nutshell, it's just, I mean, like I said, it's important to be able to balance both and, tuning in, because we tend to neglect, that part of ourselves. We tend to give and not pay attention
to ourselves.
To ourselves, especially women, that we give. And it's like, at the end of the day, so we come down crashing. If you know what I mean, come down crashing, and, because we are busy taking care of other people. So, like you said, I think it's important to always remember to do what is best, for you before you take care of somebody else, so.
And I think people also need to understand you can only be as good to others as you are to yourself. You want to be a mother, you want to be a sister, you want to be a friend, you want to be a brother, you want to, be a
wife.
husband,
Yeah.
you want to be a wife, whatever you want to be to someone, you also have to be to yourself, because at the end of the day, if you're not taking care of yourself, you can't be your very best self to other people around you. So
absolutely, yeah. So I want to thank you today. Thank you so much for joining me today to help facilitate this important public health topic.
Not a problem.
And I hope to bring you back, to, I guess, learn more about your initiative, because I think you're doing a fantastic job shining a light on mental health in Africa and in other parts of the world. So especially among youths, this is needed. And, again, thank you so much for joining me today.
No, thank you so much for having me. It was such a pleasure. Thank you.
Thank you. That was Miss Vanessa Adebayo. I want to thank her so much for help facilitating today's discussion on mental health. And I hope to bring her back so we can learn more about her initiative. I think she's doing a fantastic job in Africa, shining a light on mental health in that part of the world where it's still a taboo to talk about mental health issues. So like I always tell you, if you have any public health topic that you want me to shine a light on, or you want to appear on the show, feel free to DM me, and I'll be more than happy to address such topic. And also, I want to remind you, we have a YouTube channel, so don't forget to check it out and subscribe and turn on the notification bell to alert you when I upload new videos. Information is the link is in the bio, and please don't forget to check that out. And until the next video, please continue to stay safe and stay positive. Thank you guys so much.